Your host, Shari Criso, and this is the My Baby Expert Show for all of you who are here for the first time. Tonight we have Dr. Susan Markel, and she is back with us and just one of our favorite guests. As you know, you are all always ask me, have Dr. Susan back on. She's a pediatrician, and she's also an author of a fantastic book called What Your Pediatrician Doesn't Know Can Hurt... Taylor put it up on the screen. I didn't even have to show it. Okay, What Your Pediatrician Doesn't Know Can Hurt Your Child. And if you don't have a copy of this book, you definitely want to order one. It is fantastic. It's great. It's stuff that you haven't heard before in most cases, and just really hearing it from a pediatrician and really just real advice. So welcome, Dr. Susan. Welcome back.
Oh, it's great to be back as usual.
Oh,
Shari, thank you.
Awesome. I'm going to move over a little so I can make room so we could sit next to each other here. Here we go.
Oh, that's great.
Excellent. I love having you on the show, Dr. Susan, because you're just so full of knowledge, and my audience just eats you up. They cannot wait for you to come back. I get it. Listen, the emails come through and they're like, where's Dr. Susan? Can we do another show? So
yeah, we always have fun. It's great.
We do have fun. We do have fun. And your book is so great, and we always talk about it. We could just kind of scroll through it and just pick a chapter, and that's what we did this week was pick a chapter, right? Pick a chapter. And tonight's show, really, there were a lot of emails and a lot of requests in the past couple months, and also a lot of just people coming into the store and asking about issues with allergies, eczema, and also asthma. And I know you have a great chapters in your book about this, and that's tonight's topic. And I think it's really affecting more kids more and more these days, isn't it?
It is.
Yeah. So let's talk a little bit about the whole idea. I mean, I think you had said that 1 in 3 children, right, would be affected?
It's definitely pretty common. Yeah, that sounds about right.
Yeah.
Yes.
1 in 3. So, I mean, this is obviously, many children are going to be affected by one of these conditions. So tonight, let's talk a little bit about how does this happen? What is it? What causes it? And how do we prevent it? Because many of the moms who are watching, and moms and dads, are expecting right now and are thinking to themselves, what can I do to actually prevent this in my child?
Right. And actually, nobody knows why there's such a prevalence of allergies. And tonight we'll talk about the 3 related topics. They're all allergy related, which would be allergies, what you sometimes would think of more like hay fever type of things.
Right.
Asthma, and also eczema, also known medically as atopic dermatitis.
Yes.
The word atopic in medicine refers to things that are related to allergies.
Gotcha.
So this is kind of, I guess maybe a pun, a topic tonight.
A topic for a topic. Our topic is a topic. Got it.
Exactly. And that's what we're going to talk about tonight. And again, although nobody really knows why there seems to be an increased prevalence, I mean, certainly years ago, just as an example, we didn't have signs in our classrooms saying that, somebody's allergic to peanuts and no peanuts allowed. But now it's very common, and we have to wonder, what is it? What are we doing? What is it in our environment or in our food supply, and somehow in the chemicals or the exposures, things that children are being exposed to on a day-to-day basis, either things that they're eating or touching or breathing, that is creating these problems that didn't exist in such large numbers before.
Well, children we know today are just overloaded with all kinds of chemicals in our environment. And so it may not even be one particular thing, but a soup of chemicals that are all together that are causing some of these reactions in children.
That's right.
Yeah. And so I guess it's about really looking at some very specific things that we can do to look, we can't always control the air they breathe when they step outside, or we can't control everything in their environment, but there are some things that we can do to help minimize some of these reactions and minimize their risk, aren't there?
Correct. Yes.
Yeah.
Definitely.
So when it comes to prevention of allergies, what would you say are the most important things to do?
The book is, as you know, what your pediatrician doesn't know can hurt your child. But I have to say that the star of the book is breastfeeding.
Yes.
because I don't think there's one chapter in the book,
Yes.
no matter what the topic is, that the idea that breastfeeding is
Yes.
the best thing to help,
Yes.
to alleviate, to prevent, to increase your child's best interest of being healthy.
Yes.
And it certainly, is true with these chapters on allergies and asthma and eczema, that the best thing
Yep.
that a mother can do for her baby is to breastfeed the baby exclusively for the first 6 months.
Yep, absolutely, absolutely, and it really always does come back to that, doesn't it? I mean,
It does.
just about everything, and when we look at with breastfeeding, it is the norm, and it is what nature intended. So obviously, is it really that children who are breastfed have a lower incidence of asthma, or is it children that are not breastfed have a higher incidence? And I think that's really how we have to start to take a looking at it.
Could you repeat that, Shari?
Yeah, so what I'm saying is that, we're talking about reducing their risk of asthma by breastfeeding, where the truth is breastfeeding is the biological norm. So breastfed children have a normal risk for asthma, where children that are not breastfed actually have an increased risk. And that's
exactly. I mean, it's a matter of the point of view of the person who's making the statement or asking the question.
Yes.
And the question is, are children who are not breastfed at increased risk of?
Yes.
And the answer for any question is yes.
Yes.
At increased risk of asthma, increased risk of ear infections, increased risk of gastroenteritis, pneumonia, whatever the question is, the answer is yes.
Yes.
That children who are artificially fed are at increased risk. Yes.
Yes. Yes, and so I think it's important, even in this context, whatever your feeding decisions are, that we make that distinction so that we start to look at breastfeeding as the norm and not some bonus.
Exactly. I agree 100%.
Yep. Absolutely. What, Joe? Joe's asking.
Some people get confused.
Yes.
Like, I breastfed and they still get it.
Yes. Joe's question, and he's saying that there are people in the chat and they're talking, and this does come up all the time. And they say, look, I breastfed my children, I exclusively breastfed them, and they still had allergies. How come that happened?
Well, first of all, they would have had less allergies if you hadn't breastfed.
It doesn't prevent everything. It's not like it's a cure-all for everything.
That's right. And the thing is that, again, I mean, there are things in the environment. In fact, there are things in a mother's breast milk that are from the environment or from foods that she wouldn't want to expose the child. I mean, a mother who's breastfeeding, to at least a certain extent, is doing it because it's the natural way rather than giving formula. But on the other hand, if the mother has been told by her doctor that she should drink a lot of milk, then the baby is getting a lot of cow's milk anyway.
That's right.
And it's not necessary or it's probably not even advisable actually for women to drink milk. I always say that cows don't drink milk.
Yes.
But we have in our society this total dependence on this idea that milk and dairy is so important. So, I mean, that's just one example. It's, the breastfeeding alone, without taking into account other factors that are going on, is not going to prevent everything.
Absolutely, and that's a really good point to make because I hear it all the time. And they're also exposed to all kinds of other chemicals, whether it's in their skincare products or their diapers or their environment, or like you said, maybe something that the mom is ingesting, like cow's milk. So it's really, really good point. Is there a hereditary link between allergies and asthma? And allergies and asthma or allergies or eczema.
Yes.
all the above. Is there
that children do inherit a tendency to one or two or three of those. And in fact, it can change during the child's lifetime. But there's an inherited tendency, a genetic predisposition to be an allergic child based on whether or not one or both parents have allergies, and the incidence of a child having allergies actually goes up to about 75% if both parents have allergic tendencies. So it's not really the luck of the draw for that child.
Yeah, I was reading that in your book so it's pretty high. It's about, like you said, 75% if both parents have it.
Exactly, yes.
Yeah, and then that decreases significantly when one parent is not allergic?
It goes down by about half. Usually, statistics, it's different for every child, but if one parent is allergic, then the child has probably about a 35% chance of having allergies.
Okay. Now, what about food? So there's different types of allergies. I mean, we could be allergic to foods. We can be allergic. There can be like seasonal allergies. There's environmental allergies. There's all different kinds of allergies. Now, when we're talking about foods, what's one way to help prevent allergies to foods?
Two ways of answering that question. One is that what children should be eating.
Yes.
Another would be what children probably should not be eating.
Yes.
But I mean, I think, one of the points of the book is that the most important thing that we can do to promote our child's health is healthy nutrition. It is by far more important than all the vaccines combined and all the antibiotics and over-the-counter cough medicines that a child is ever going to get.
Absolutely.
That good, wholesome nutrition, food that is whole, food that is from the earth, food that was grown and is taken from the place that it was grown in its natural state to more or less to the table, as opposed to packaged foods, processed foods, that have additives to, things added, things taken away, artificial foods. It is by far the most important thing. And so that, by giving children healthy, whole foods, that alone is strengthening the child's immune system and making it less likely that they're going to have the inflammation that goes with allergic tendencies.
Right.
And then, as far as, foods that do cause allergies, I mean, there's certainly a list of, I think there's about 8 foods that the American government insists that be in food labels, so that parents could know that these things are ingredients. So the package would have to list certain things like peanuts, as you probably know, and eggs and dairy. Dairy is a big one, of course.
Yeah.
Wheat, chocolate, and tree nuts being totally different than peanuts. So those things are, those are the things that children tend to be allergic to. But then, to talk about it from a different point of view, and why are there so many allergies to these foods that never used to exist? This is what we started talking about earlier.
Yeah.
That apparently the American Academy of Pediatrics has done a great disservice to children by, for years, telling mothers not to give these foods and to say that you should not give eggs, for instance, until the baby's 2 years old, not to give peanuts till the child is 3 years old. And apparently what's happened is we've created a generation of children who are allergic to the very foods that had been avoided when they were younger because they just don't tolerate those foods.
Yes.
And that's why in other countries where, for instance, peanuts are given readily to babies in Southeast Asia, in Africa, in the Middle East, there's no such thing as food allergy because of peanut allergy, rather, because children are given peanuts or peanut sauce from a very early age.
Yes.
So, a lot of times things that happen in medicine and certainly in pediatrics are not what we call evidence-based. They're just kind of, hand-me-down myths about how things should be. And then it's fascinating how many things in pediatrics turn out to be refuted by carefully done studies. And this is exactly an example that the American Academy of Pediatrics has now reversed its stance and said that after the age of the 4 to 6 months of breastfeeding, that babies should, in fact, that parents should not avoid any particular food because it has absolutely no effect on whether or not the child is going to develop allergies. If anything, it would avoid development of allergies.
This is huge, especially when it comes to peanuts and peanut butter. This is a question that comes up all the time about, I feel so worried. I ate peanut butter during my pregnancy. I ate peanut butter while I was breastfeeding. Is my child going to have a peanut allergy? And what we're basically saying is that it's that early exposure to these foods that help to prevent allergies versus cause them, and this is completely opposite of what we've been taught.
That's right, and I don't know that pediatricians are really on the bandwagon with that. I mean, the American Academy of Pediatrics change in stance came about in 2008, but I wouldn't be surprised if most mothers are still being told to avoid these potentially allergenic foods.
Yeah, absolutely. And that's not the recommendation. And it hasn't been for several years. It's just that many times doctors are not completely up to date on what they should be recommending. And could actually, in this case, be causing the problem that we're trying to prevent.
Well, that's typical. That's why I wrote the book, because so many things in pediatrics are problems that are in fact created by the pediatric profession.
Yes.
And then the pediatricians step in to solve the non-existent problem and are hailed as heroes by the parents who feel that the pediatrician has identified the problem.
Yes.
Without realizing that it's the pediatric profession that has caused the problem in the first place.
Yes. I'm seeing somebody in the chat room is saying that she has a history of peanut allergy in the family. In that case, I think there's a little bit of a difference.
No, I mean, it might well be not a difference. It might well be
unless that mom herself is allergic to peanuts, she should be staying away from it.
All right, the mother, but I mean, as far as the child, no. I wouldn't see any reason to avoid giving peanuts to the child, because that in alone might, of course, this is, don't do anything without some medical supervision here, but I don't see a reason to avoid giving peanuts to a child, even if the mother is allergic to peanuts, because it doesn't follow.
Dr. Susan, it's so interesting. It's, growing up, I don't remember not one person in my entire school, never growing up as a child, a friend, ever being allergic to peanuts. And
I know, I agree.
I mean, do you remember anybody growing up having these extreme peanut allergies and anaphylaxis reactions? And I mean, my children have kids in their class. They have peanut tables and non-peanut tables, and this classroom can't have this. And I mean, the allergies are just rampant.
I know, it's amazing, and I think that part of it is that because a lot of times, fear is the great motivator, and the medical profession, as many other professions, insurance companies, even whatever, they base what they're selling on fear, and so the medical profession has created this climate of fear for the past 10 and 15 years of parents being afraid to feed their children food. Yeah. And now as I said, we're raising a generation of children that are in fact unable to process certain foods and are in life-threatening situations because of it.
Absolutely. The other thing I wanted to bring up before we move on is just the age in which we introduce solid foods to our children, because I think that there's some confusion there too of when is the appropriate time to introduce a baby to solid foods, and how does that affect their incidence of allergies or their development of food allergies.
The official recommendation of the American Academy of Pediatrics and the World Health Organization is that babies be exclusively breastfed for the first 6 months.
Yes.
And exclusive means breast and nothing but. Breast milk and nothing but. No water, no artificial formula, no juice. No food. No other food.
Right.
And because the breast milk is considered to be the perfect food. And so we don't want to deviate from that. And as a matter of fact, the babies who are not breastfed, the babies who are on artificial formula, whether it's soy or cow's milk, it's recommended that they be started sooner, approximately 4 months, only because it is felt that not breastfeeding is not giving the baby total optimal nutrition, and the baby could be missing something from the diet.
Yes.
And therefore, to possibly avoid any deficiencies when babies are not breastfed, to start giving other foods. So, but the fact remains is the optimal way to feed an infant is 6 months of exclusive breastfeeding.
It's very interesting, and I think this is the part where it becomes confusing for some parents because it's kind of wishy-washy in some articles and things that they read online or books. It'll talk about introducing solids somewhere between 4 to 6 months, and what we're saying here is that if you are breastfeeding your baby, then exclusive breastfeeding for the first 6 months is the recommendation with no nothing else. And if you're formula feeding, then actually introducing a little sooner, around 4 months, is the recommendation, correct?
Yes.
Yeah,
Yes.
yeah. I think that there's definitely confusion in that area, and I think we need to, because I have a lot of clients who are exclusively breastfeeding, and their pediatricians are telling them they can start solids at 4 months, and I'm saying no, we don't do that till 6 months. Okay, so that's really great, a great thing to learn here. What about environmental allergies and different things in the environment that can cause, and how do we handle that?
Well, yeah, I mean, there are so many things in the environment. I mean, children are again, breathing things and touching things and even, ingesting things that just didn't exist years ago. And so it's really no surprise that the children's bodies are seeing these things as foreign.
Yes.
And really what the definition of allergy is reacting to something foreign.
Yes.
And the body is trying to overcome it, to get rid of it, to create inflammation against it.
Yes.
And therefore we're seeing, a tremendous amount of inflammation in these children's bodies because of the chemicals and the toxins in the environment.
Let's talk a little bit about where these chemicals can be coming from that you might not even realize, okay? So I'm going to name a few. First, like we said before, just the mattress that they're sleeping on, the amount of chemicals, the formaldehydes, they can actually measure the fumes the gases that come off of a regular crib mattress when it's not an organic mattress. And this is something your child will be laying on and breathing in for several years. And it may be something that you're not even thinking about. Like Joe said, we had no idea, 9-10 years ago. But if there was one thing that you could really do that would be organic, would be your child's mattress. Another place to really consider is all the skincare, the creams, the lotions, the shampoos, the baby oils, all of those things. I mean, many of the products on the market are completely loaded with different chemicals and toxins. You want something that's organic. I see Earth Mama Angel Baby in the chat room here. I said Alicia in the chat room with us, and it's Michelle. We just really want to understand that a child's skin is very thin and porous, and the weave of their skin is such that anything that you put on them will get absorbed right into their bloodstream. And so even just as it is important for us to use organic products on our own skin, it's even more important when it comes to our babies and our children. It's just another route that a chemical can pass very freely into the bloodstream and into the body, right?
That's absolutely right. And in my chapter where I talk about eczema, which we might or might not get to tonight, I explain that a recent study showed that 61% of children's bath products, the baby's bath cleansers, soap, shampoos, contain chemicals that are extremely dangerous, like formaldehyde and other carcinogenic substances, and that these things are not listed on the label because of ways that it could be gotten around. They're just listed as fragrances, or they're listed as, or they're not listed because they're byproducts of the manufacturing process, but they're not actually ingredients per se.
Yes.
But I have to say that the worst product that I have ever come across in my 34 years of being a pediatrician consistently is Johnson's baby soap, the kind of the gold liquid.
You mean the one that they use on every baby in almost every hospital in the country?
If that's the case, I suppose I don't know what's being used, but I know that the parents who come into the office with the kids, these babies all have rashes and dry skin. And I mean, the parents are always so surprised because it's like an American staple to use Johnson's baby soap, the liquid soap, and it's the number one thing that I tell parents: if you stop using that. And the ingredients in it, it's got perfumes, it's got dyes, it's got the formaldehyde and this dioxin and all kinds of stuff. It's very bad for baby skin.
Well, one of the things that people can do if they're questioning about the products that they're using is they can go to cosmeticdatabase.com and put in the products that they're using. It'll give you a rating of what toxin level and what kind of ingredients are actually in the products. So, for example, if you were to go in and type in Johnson & Johnson's going to be extremely extremely high, somewhere up in the, I don't know the number, but 9, 10s in their toxicity. Or when you put in something like an Earth Mama Angel Baby, you're going to come up with zeros across the board. And I think it's really important to look and to identify where does your product fit in and what is it exactly that you're putting on your child. One of the other products that is also highly toxic that a lot of people are not aware of is Desitin. And
is that right?
Yeah, Desitin.
I wasn't even aware of that.
Yeah, Desitin it's got an ingredient in it that is one of the most toxic chemicals that you can put on your skin, and actually it embeds in the baby's brain, and they've seen it on autopsies where this just never comes out of their body. So and this is a very benign. I mean, you just pick it up, you think, oh, diaper cream, but you can go and you can look this up as well. So Desitin is one of those really bad products that I would stay away from as well.
Oh, good to know.
I wonder if our audio is going to go out again now.
I
know. The beauty of being able to do your own show and say whatever you need to say, right?
That's right.
I love it. Okay, awesome. Let's move on to eczema, because I think that this is such a hot topic. So many of the parents have emailed us and have the same issue with and one more thing I want to say, I didn't get to say, is the other area that they are getting extreme exposure to chemicals is also in their diapers. Okay, so if your baby is having some kind of reaction, not only in their diaper area, but I've had cases, and we're just about to talk about eczema, but I had a case where a baby was covered head to toe, literally from the top of their head to their feet in eczema. They had tried everything on this child, and in the end, what we did is we switched her into cloth diapers, and within 3 days, the eczema had completely cleared up. So you can see that the baby was having a systemic reaction to a chemical that was in the diaper, and you can understand that it's something that's on their skin 24 hours a day, 7 days a week, and they're loaded with chemicals, including dioxin and other really bad stuff. So diapers are in that list. If I had to include between the foods, the mattress, the diapers, and the creams and lotions, I think you're really looking at the top of the list there. Let's talk about eczema a little bit, Dr. Susan.
Yes.
So what exactly is eczema?
It's really a deficiency of the skin barrier. Usually there would be a skin barrier made of certain kinds of cells and certain kinds of fatty chemicals that keep moisture from evaporating from the child's skin.
Yes.
And at the same time, the skin barrier will keep chemicals from getting in.
Yes.
And there's a defect in the skin barrier in these children, and so the main manifestation is that the skin loses its moisture, becomes dry, becomes itchy. The child scratches it, it becomes red, it can become weepy, and then it gets into a cycle of the itch, scratch, itch cycle, and it keeps getting worse.
Yes, yes. And so there's a lot of different advice when it comes to eczema, and one of the things that I think is most important to understand is that whole understanding of the moisture barrier, of losing the moisture in the skin.
That's right. And so the most important thing that you can do for your baby, if your baby has eczema, is to restore the moisture to the skin, and that is basically something very simple. It's bathing the baby. Yeah,
which is the opposite that a lot of pediatricians will give as advice, is to bathe less. We're talking about more bathing.
Absolutely. That the baby should be bathed as much as possible, daily, and to stay in the bath for 10 or 15 minutes to get those cells all plumped up with water, and then when you take the child out of the bath, within 3 minutes, no more than 3 minutes of and barely even drying the child, just kind of patting the child dry, but not really totally drying, heavily with a towel, to then seal in that moisture that you've just gotten from the bath with some kind of a barrier, cream or oil or lotion, something that's hypoallergenic and something that is basically a barrier that that water doesn't mix with.
Yeah, absolutely.
So could be it could be something as simple as vegetable oil. Coconut oil is very good for that.
Yep.
And then it literally will seal in. And the thing is that to not bathe and to then put cream or lotion on skin that has not been wet is completely useless, because what you're doing is you're sealing in the dryness. It doesn't do anything. It has absolutely no effect whatsoever on the eczema.
Yeah, absolutely. So, okay, so great. So the baby comes out of the bath, and while there's still moisture on the skin, that's when we would go ahead and put some kind of an oil, even like the Earth Mama Angel Baby oil, or like you said, a coconut oil, or something that's going to keep that moisture in. And it's not the water that's causing the eczema. It could be the soaps that you're using are drying out the skin.
Yes, absolutely.
It could be the soap. So it's not the water that's actually doing it. The water actually will help to prevent.
Yes.
Absolutely. Okay, great. So let's just let's keep talking just for a minute about different things that you can do in your home. So there was a question that came in from a mom. She said she's a first-time mother. She's due in and she wants to know what's the best thing that she could do to prevent allergies in her baby. Like, what's the best thing she could do in her home to help prevent allergies?
To avoid having a lot of different chemicals in your home, and that would include all kinds of things like cleaning. Things that you use to clean that it has a lot of toxic chemicals. To avoid any smoking, certainly no tobacco smoking, or even people coming into your home who have been smoking, because there's something called third-hand smoke where it's on people's clothing, the chemicals.
Oh, we get that.
Into your house.
We get that question all the time. It's not just secondhand smoke. We're talking about third-hand, where somebody's been smoking outside and now their clothing smells and holds the chemicals in the clothes. Correct?
That's right, and I think that might even be why a lot of hotels these days don't allow smoking at all, or they have non-smoking rooms, because even though the person who was smoking is no longer there, and the smoke is no longer there, but the chemicals are now in the drapes, and in the carpeting, and in the bedding, and therefore people will be exposed to chemicals long after the person is gone.
Yes.
Or a person will still have chemicals on their body and on their clothing even after they're not smoking anymore.
Yes. Okay, great. Yeah, and I think a lot of people don't realize that. I've had questions where they say, my father-in-law smokes. What do I do? He wants to hold the baby. He smells like smoke. I would say, they probably need to change their clothes and get those clothes off before they're actually holding a newborn or a child, correct?
Definitely.
Yeah. Okay. And also, I know that just carpeting, drapes, right? All the other fabrics in the these all can lead to higher incidences of asthma, difficulty with breathing, right?
That's right. And one of the reasons is that the chemicals will live in these fabrics, but also dust. These are dust collectors, and dust is basically it's like a factory of toxic things that are from the environment, from outdoors and from indoors, and so trying to avoid dust would be a reason to not to have a lot of dust collecting things like upholstered furniture or heavy carpeting or draperies, and that if you do have those things, that it's really important to clean them thoroughly, and to, when you dust with a vacuum cleaner, to use a cleaner that has a vacuum cleaner that has a very good filter that's called a HEPA filter.
Okay.
Because otherwise, if it doesn't have a good filter, the chemicals are going right out the back of the vacuum cleaner, right back into the room.
And they're actually getting pushed into even circulating into the air even more, wouldn't you say?
That's right.
Yeah, probably even worse.
That's right.
Yeah, what about humidifiers? Because I know, we have a humidifier that has no filter in it, but for those humidifiers that do have filters and they need to be changed often, you're actually blowing mold spores into the air, correct?
That's right, and mold is a very highly allergenic substance, and so children who might be allergic to mold, it's important to keep the to keep the humidity down in the house, to keep the house drier. That would be very important.
Okay, so keeping the house drier, and then if you do use a humidifier, to try to use one that doesn't have the filters, that have the non-filter humidifiers, or make sure that you're changing them very frequently so you're not blowing mold spores into the air. I know
Very
people
good.
who just keep those humidifiers around for years, and it's very unhealthy.
Right.
And what about what about in the winter time when it's really, how about the humidity, keeping it moist for a baby? Because we get a lot of mixed opinions about whether the air should be humid. It'll make it easier for them to breathe. You're saying to keep it drier. What's the right thing to do?
If a child is having any kind of upper respiratory symptoms, then you do want to keep it more humid, because it keeps the swelling down, and it keeps the mucus looser, and so the mucus will drain as opposed to getting stuck and all thick and getting stuck in the ears, for instance, and causing ear infections. So I mean, it is a very good. I mean, for that particular issue, for children who are having coughs and colds, it is good to use the humidifier.
Yes.
Years ago, they used to use a croup tent. It was called a croup tent in the hospital. They would basically, have the child in a crib and put a big plastic around the crib and put what would amount to a humidifier inside there, so that got all misty in there, and that's very good for children, to help children breathe.
Yes. Awesome. Okay. So yeah, there is, it depends on the child. I know my younger one has a lot of difficulty breathing when the house gets really dry and the heat's up. So we do use a humidifier with her, one without a filter. And then the rest of the time, what we're talking about is keeping it drier to prevent all the mold from growing, right?
Right. And I mean, in situations where there are allergic tendencies, definitely, yes.
All right, great, awesome. What else? What have we not covered, Dr. Susan?
Well, let's see. We talked about food allergies, and I don't know if we really talked about airborne allergies, either from indoors or outdoors, things like, well, I guess we talked a little bit about indoor allergies. I will say that that babies, children have to be exposed to something more than once in order to develop an allergic reaction. That's kind of a good blanket statement to explain things. That, for instance, with food, a child has to have had a food more than once. So sometimes parents will say, well, I know it can't be the eggs, because the child's had eggs, many times before, so it can't be eggs. And yet that really is the point, that you have to have been exposed to something more than once in order to develop an allergy to it. And what happens is that sometimes children actually crave the thing that they're allergic to. They love it. They have it all the time. And it's always a surprise when I suggest, for instance, that maybe your child is allergic to milk. It's a child that's having either eczema or always a runny nose, always itchy, a lot of ear infections. And then I'll say, well, maybe your child is allergic to milk and dairy. And the mother will say, oh no, I mean, that's all the child has. The child loves it. And I say, well, yeah, I know, that's the point. Maybe you should try eliminating milk and dairy. And then the mother will say, impossible. That's all the child gets. I couldn't possibly do it. And so we're in the situation where I have to explain that it's the thing that the child is getting a lot of, that the child loves, that the child craves, that is actually making the child sick.
It's so interesting that you're saying that, because that's exactly what my 7-year-old does, and she is allergic to milk more and more as she's gotten older. She's had more and more sensitivity to dairy, and she gets stomach aches now when she drinks it, and she definitely has a cough, more congestion. And one of the classic signs that my pediatrician picked up were the shiners that we call them, the black eyes, like dark circles around her eyes, which it could actually be a sign of an allergic reaction to the food.
It is, because what those allergic shiners are, it, looks basically like the child has a little bit of a black eye underneath. It's because of congestion from the sinus congestion that the blood isn't flowing correctly because there's so much congestion, and so you see that darker cast. And allergic shiners are definitely something that pediatricians pay a lot of attention to. Yeah.
Yep, my daughter definitely has them, and we've actually, and not only just for the fact that ever since our episode on cow's milk, I completely took milk out of the house. And if somebody brought up, we haven't talked at all a lot about asthma, but I want to say that, all these things are linked to asthma as well. Everything that we discussed, it all kind of, the hereditary aspect of it, the breastfeeding specifically, the secondhand smoke. I think there's a new study that just came out of the Netherlands just this year in July, I think. They looked at almost 5,000 school-age children and saw that that breastfeeding, we've always known this, but they really showed the significant reduction in asthmatic symptoms in breastfed children. And the longer the duration of breastfeeding and the more exclusively that those children were breastfed, the less asthma they were seeing.
That's right. And there are actually some interesting theories, and I believe it might be that particular study as to why that is, because it wasn't only the ingredients in the breast milk, but it was thought to have to do with the actual physical aspects of a child breastfeeding, the amount of using the masticator muscles and the kind of breathing that goes on, as opposed to a baby who's being bottle fed, where basically if you turn the bottle upside down, the milk just comes out. And so the baby's breathing is constantly interrupted because of the constant swallowing. The baby doesn't have to use any effort, doesn't have to use any lung effort to get the milk.
Yes.
It's just, in fact, if anything, the baby has to kind of keep stopping to swallow, stopping the sucking, not having good in and out breathing because they just have to keep stopping the breathing. And so it was really, the thought was it was actually a mechanical reason that babies who are breastfed avoid having asthma later.
It's so interesting because so many people think it's just the milk, and it's really it is breastfeeding itself, and like you said, the mechanics of breastfeeding, the mouth and jaw development, the way that the structural development that occurs when a baby sucks at the breast has so much to do with their long-term health as well as the milk itself. So this is something to consider, especially if someone's planning to exclusively pump and think that that's the same as breastfeeding. You really want to do some feeding at the breast.
That's right. I mean, I always wonder why a mother, frankly, is only pumping anyway, because it doesn't.
It's so hard to do. Yeah. I think a lot of it comes from fear and worry and concern, and they really just don't know. And I think if anything, if that's somebody, if you're watching this and you're thinking, I want to give breast milk, but I'm just planning to pump it exclusively, don't choose that option off the bat. It's not something that you choose. If you have no other choice, it is obviously better than nothing, but it is really hard on you, and it still doesn't give the baby all the benefits of nursing at the breast.
That's right.
Excellent. I love you guys. Mwah!